Hey, this is Dr. Salisbury at Brain and Spine. Tell us who you are and what you've been experiencing before you came in.
Yeah, I'm Alana Tenney, and before I came in, I had headaches every day. I was dizzy all the time. I had sharp pains in my rib, and I have had thyroid problems since high school, as well as breathing problems. And all of these things are 100% better. And now I have the energy to be a good mom and a good wife and do so much more than I could before.
Thank you. Tell us about that rib pain. Where was it?
It was here, and it went all the way up through my armpit and into my shoulder.
What kind of doctors or practitioners had you gone to kind of figure out what the heck that was all about?
I had all the blood work tested. I had my lungs tested and my heart tested, and nothing came back with a problem. So.
Okay, and you described something about a tightness in your chest, and did that influence how you felt ever?
I was just always tired. I never had energy. It was hard to breathe.
Right, yeah. And shortly after seeing us, you started seeing improvements, obviously,
Yes.
and then continuing on. And there's actually a few things we're going to share with her case so you can see why and how she got better. It had to do with upper cervical chiropractic, the top bones in her neck. You can just see how much twisting there was. The very top bone in her neck was so twisted, and that was contributing significantly to all sorts of other functions. Another thing is these thyroid improvements. Tell us about your brain fog. What did you feel?
I just couldn't think clearly, but now I can.
Isn't that crazy?
Yeah.
What do you do with your newfound clarity?
I play a lot more with my kids and don't lay on the couch as much.
Oh, that's great. So here's one of the things. We use low-level laser in our clinic. It's one of the many things that are evidence-based that we can do that helps thyroid conditions. So 1 out of 4 women actually have hypothyroidism. So it plays a role on your hormones and your mood, and it affects multiple systems of the body, right? So here's a study out of the International Journal of Endocrinology. So they show safety and efficacy of low-level laser therapy in autoimmune thyroiditis. So one of the things we want to share with you is after doing a series of laser treatments, this was a 6-year-long study. So we're talking about a randomized controlled trial. They take a group of patients who get the intervention 11 months after they stopped getting several visits of laser therapy, which is directly done here on the thyroid. The low-level laser therapy actually decreases inflammation, and it reverses the effects of the autoimmunity, which is attacking the thyroid, resulting in all these symptoms. There's other ways and more detailed ways to go after the actual cause in the gut that mitigates the effects of what's going on. But if we just do laser on the thyroid, we get profound changes to the function of the thyroid and the brain and the hormones. So if you look at this, 11 months later they tested, and the patients who received the treatment actually had a dramatic improvement in their symptoms, and they needed much, much less medication, if any at all. Half the subjects didn't even need any medication at all. And this is after doing, I think they did 8 visits with laser, and then 11 months later they continued to improve. Whereas the placebo group who did not receive the intervention, they continued to get worse. And 6 years later, obviously, their thyroid had gotten back to the same level. So it's a gradual, slow process of the autoimmunity attacking the thyroid. So when we see a lot of our patients who have thyroid conditions and they feel functionally better in their brain, it's because we're actually addressing the cause in many instances, or in this case, we're literally helping the thyroid calm down and getting rid of the inflammation that's causing all these problems. So thanks for staying tuned, and thanks for sharing your experience with people so people can hear about what makes people better in a naturally healthy way. If you have any questions, shoot them to us. We're happy to give you evidence-based literature that explains why and how we get the solutions we're getting in our office over and over again, and all the complicated neurological conditions, why people are getting better with our interventions. Thanks for staying tuned.